Is the scene safe? Yes. All right, I have my BSI. All right, there appears to be a 15-year-old male dog. He's been in a car accident. I'm gonna have my EMT partner stabilize his C-spine immediately. All right, can you hear me, dog? Can you hear me? Can you hear me, dog? How about, is there any response to pain? Can you hear me? No, there's no response. He is, he's unconscious. So my partner's gonna continue to maintain C-spine stabilization throughout the whole exam. First thing I'm gonna do is just do a quick glance for any gross bleeding. Do I see any? No. Okay. At this point, I'm gonna assess the airway. And what do I see? The airway is there's gurgling sounds. Okay, I have an EMT partner suction that. Did that clear that up? Great. All right, now I'm gonna assess breathing. Do I see equal chest rise? All right, he's breathing. All right, now circulation. I'm gonna check a radial and carotid pulse, and I'm not checking the rate at this point. Just presence and quality. How those looking? All right, he has a nice strong pulse. Great. How about the coat quality? Is he warm or cool? Dry, diaphoretic? Diaphoretic, okay, signs of shock. We're gonna have to activate ALS, make this a priority patient. All right, at this point, the patient is unconscious, so we can't do a true sample report, but I'll have one of my EMT partners check the car for any medications. Just a quick glance. We don't see a medical bracelet. Oh wait, what's this? No, it's not a medical bracelet. Okay, at this point, I'm gonna do my secondary assessment. So head to toe exam. I'm looking at the skull and face. Anything notable there? Okay, checking pupil dilation. Equal and responsive. Great. All right, how about the throat? Anything unusual there? Any deviation? No. All right, I'm exposing the chest. What do I see there? Oh, there's a puncture wound. Okay, I cover that with my glove and have one of my EMT partners put a 3-sided occlusive dressing on that. Definitely a priority patient. I'm glad we activated ALS. All right, we're gonna palpate the abdomen. What's the quality of that? All right, now we're gonna expose the legs. Check the legs. All right, I'm checking distal circulation, capillary refill, or pedal pulse. All right, can you hear me, sir? No response. No. Patient's unconscious. Checking the other leg. Same thing. All right, checking the distal pulse. And can you hear me, sir? Can you feel this? No. All right. Checking the arms the same way. Do I see any medical jewelry? No. Can you hear me? Can you feel this? Checking the other arm. Can you feel this? All right. At this point, we begin transporting the patient. We're going to recheck the vital signs every 5 minutes. We put that occlusive dressing over the chest. So we're going to have to make sure that keeps doing its job and get this guy to the ER. No, I didn't miss anything. Is the scene safe? Yes? Okay, I have my BSI. Okay, as I approach the patient, I'm gonna have my EMT partner stabilize her C-spine. Can you hear me? Can you hear me? Hello? The 30-year-old patient who's been in an automobile accident doesn't respond. Any respond to pain? Nope. Okay. I've already looked. Did I see any signs of gross bleeding? Nope. I'm gonna assess the airway because there's a possibility of Neck damage, we're only doing a jaw thrust. So I do a jaw thrust remover. What do I hear? There's gurgling sounds. Okay, one of my EMT partners will do a suction on that. Did that resolve the airway problems? Okay, great. At this point, I'll assess the breathing. So do I hear breathing? Do I see chest rise? Equal chest rise, great. Okay, now I'm checking circulation. I'm checking the radial and carotid pulses, just for quality at this point, not rate. What do I see? What do I feel? Okay, nice strong pulses, that's good. All right, I'm also checking the skin quality, temperature. Is it warm? Is it cool? Is it dry? Is it diaphoretic? Okay, diaphoretic, it's a sign of shock, so I'm gonna make this a priority patient and activate ALS. All right. At this point, I'm going to, I can't take a sample. I can't do a sample assessment, so I'll have one of my partners check the vehicle and ask around to see if we can get any medical history. And now I can go on to my secondary assessment. So I'm gonna start with the head. I'm checking behind the ears, and I'm checking eye and pupil response. Equal, okay. Checking the face, checking the throat. Okay, I'm exposing the chest and taking a look there. I'm listening for lung sounds. Palpating the abdomen. Anything notable? Nope. Okay. As I continue down, I'm gonna have one of my EMT partners take vital signs. I'm checking for pelvic fracture. There's a pelvic fracture. Okay, we're gonna put a splinting strap on there, stabilize that. We're checking each leg all the way out. Can you feel this? Can you feel this? Do I have a pulse? Great. Checking the other leg. Any injuries? Can you feel this? Is there a pulse? Yep. Okay. Checking each arm. Same thing. Can you feel this? Any response? Is there a pulse? Any injuries on this arm? Oh, broken arm. Okay, I'll have an EMT partner splint that. Prior to the splint, we'll do a CSM. Can you feel this? Is there a pulse? Weak pulse due to the fracture. Okay. At this point, while my partner continues to maintain C-spine, we'll roll the patient and just do a quick sweep of the back. And that concludes the secondary assessment. At this point, we would begin transport. We're going to reassess the vital signs every 5 minutes. We'll check the CSMs on the splinted limbs and get this girl to the ER. No, I didn't forget anything. All right, you're free to go. You're free to go. Get out of here. Is the scene safe? I've got my BSI. All right, the patient is a 24-year-old Equus Cabalis, and he's been involved in a tractor accident. As I approach the patient, I'm gonna have one of my EMT partners stabilize his C-spine. All right, I do a cursory glance just to see if there's any gross bleeding. Is there? Nope. All right, as I'm approaching, I'm assessing the patient's level of consciousness. Can you hear me, sir? Can you hear me? Can you hear me, sir? Can you feel this? There's no response. Okay, I give him a little pinch on the shoulder. Any response to that? No. All right, patient appears to be completely unconscious. All right, we're gonna check his airway. Because there's a possibility of a C-spine injury, we're gonna do a jaw thrust. And what do I see when I look in the jar and listen? Right, there's gurgling sounds. Right, I have one of my EMT partners suction that. Did that clear the airway? Okay, great. The airway's clear. Now we'll listen for breathing and we'll look at the chest for chest drives. In his case, on both sides of the chest. Okay. I see bilateral chest drives. That's good. Okay. At this point, I will check for circulation. So I'm checking for a carotid pulse as well as a digital pulse. And I'm just looking for the quality at this point. Strong, steady, great. Okay. At this time, I'm also checking for any bleeding a little closer. Do I see any gross bleeding? No. Also checking skin and coat quality. What's the skin looking like? Is it cool or warm? Is it dry? Is it diaphoretic? It's diaphoretic. Okay, that's a sign of shock. We're gonna have to get this guy bumped up in priority and activate ALS. The patient appears to be shedding all over the place. All right. Now that I've assessed the airway, breathing, and circulation, I can't get a sample report from an unconscious patient. Are there any bystanders that can give information? No. Okay. I don't see any medical jewelry, but we can check the tractor maybe for some documentation of that. I'll have one of my EMT partners do that. Now we're going to do a secondary assessment, which is a head to toe exam, checking the skull behind the ears, any crepitus. No. Checking for checking the eyes. Pupils are very strange. Okay. Checking the face, nose, checking the neck, any distension, anything notable on the neck? Nope. Okay, we're exposing the chest. See anything notable there? Okay, we're gonna listen for lung sounds. Okay, as I continue my head to toe exam, I'm gonna have one of my EMT partners take vital signs on one side there. Okay. Palpating the abdomen. What's going on there? It's firm. Okay. All right, we're gonna check the pelvis. It's intact. All right. Doing a detailed assessment of the legs. So first expose those all the way down, checking for injuries, lacerations. Okay, looking for a digital pulse. Okay, it's present and strong. Good. Okay. Check the other leg here. Checking the whole leg for injuries. It's exposed. Any fractures, crepitus. Checking that digital pulse. Okay, can you feel this, sir? Can you move it? Patient's unconscious, no response. Okay, now we'll do the same thing on both arms, both front legs. Any injuries? Pulse. Can you feel this? Can you move your leg? Can you move your leg? No response. Patient's still unconscious. Okay, checking the last one. Any injuries? Okay, checking that digital pulse. Can you feel this, sir? Can you move your leg? All right. At this point, we will transport the patient. We'll monitor his vital signs every 5 minutes since the signs of shock, and get him to the emergency room. There weren't any other injuries that we immediately addressed, so it'll just be the vital signs. All right. No, I didn't forget anything.